Good morning, everyone. I'm happy to be here today to share some truly exciting news. Today, we are taking an important step forward, one that represents years of collaboration, planning, and dedication, and reflects our shared commitment to building a healthier future for Albertans. I know a lot of people have been waiting for this announcement for a long time, so I won't keep you waiting any longer. I'm very proud to announce today that we have officially selected the site for a new standalone Stollery Children's Hospital, just 15 minutes south of where we are gathered today. Choosing this site is a promise to Alberta's children and families. Our vision for quality healthcare has them at the center. With Alberta's strong economy driving population growth, more families are choosing to call this province home. And with that growth comes an increase in demand for healthcare services. We're working hard to meet that demand. That's why through the 2025 capital plan, our government is investing $3.6 billion over 3 years to build new health facilities and upgrade existing ones. This commitment includes planning one of Alberta's most important health projects, the new standalone Stollery Children's Hospital. Choosing the right location required many careful considerations. One of the most important factors was ensuring it would meet the needs of families today and well into the future. The new site is located on the University of Alberta's South Campus on the northeast corner of 122nd Street and 51st Avenue. It offers ample space and flexibility for future expansion, vital requirements for a hospital that will need to grow and adapt as healthcare needs continue to evolve. Being close to the North Campus will strengthen collaboration with academic and research partners, thereby supporting innovation in care and treatment, so our amazing frontline doctors and healthcare workers can deliver the best care to our children. Currently, the site is undeveloped green space, which means construction can proceed without demolishing or relocating buildings, allowing us to streamline the timeline and quickly build the best facility possible. With this milestone reached, planning has begun to determine the hospital's space and service needs. Projects like this involve several critical steps before construction can begin. We wrapped up the business case last year, and we're on track to finish the rest of the planning phases in 2026. Then we will secure the funding necessary to carry out the construction of this modern, world-class children's hospital. In the meantime, we're keeping momentum by moving ahead with site readiness and servicing. Our government began investing in this project in 2021 with an initial $1 million, which was matched by the Stollery Children's Hospital Foundation. Budget 2025 committed another $11 million over 3 years to advance planning and design. As a father myself, I know how agonizing it is to have a child who is unwell, and how important it is for families to have access to the best pediatric health care possible. I also know this isn't just about building a physical structure, it's about creating a positive, healing space where kids can still be kids, even when they are unwell, and where parents can feel confident their children are receiving the best possible care close to home. I want to personally thank everyone who helped make this announcement possible, especially at the University of Alberta and the Stollery Children's Hospital Foundation. What we have achieved together is extraordinary, and what lies ahead is even greater. Thank you again for taking part in today's announcement. I would now like to invite Minister Jones to the podium.
Good morning. It's a pleasure to be here for this important milestone in the evolution of the Stollery Children's Hospital. We can all take pride in the legacy of the Stollery, which has biggest patients for years. The Stollery name is trusted by parents. When a child or teen needs help, families know they'll be well cared for. Whether it's an accident or something more serious, the experts here always deliver. That's a reputation we're proud to invest in with this new chapter for the Stollery. Building a new hospital in an urban centre is no small task, but we're on the right path. The current Stollery is one of the busiest acute care facilities in the province, serving children from Edmonton and across northern Alberta. Thousands of babies, children, and teens, many travelling from home, come here for care. Some quick facts: it was established in 2001 and has among the highest inpatient volumes of any children's hospital in Canada. The Stollery serves a geographic area in excess of 500,000 kilometres, and over 40% of the patients come here from outside of the Edmonton area, including from BC, Saskatchewan, Manitoba, the Yukon, and Northwest Territories. We chose the University of Alberta South Campus so we could design a state-of-the-art facility from the ground up, with more space for treatment and future growth, while staying close to the University Hospital for additional services. And we're working closely with the University of Alberta's Faculty of Medicine and Dentistry throughout the planning process, ensuring their expertise guides our path forward. My ministry is also working closely with Alberta Infrastructure every step of the way. Now, with the location secured, we move into the functional programming phase, where we plan how the new Stollery will operate, from the number of beds and family spaces to the placement of diagnostic equipment and even IT. Every detail matters because we want to set our healthcare professionals up for success and ensure families get the care they need when and where they need it. That's why capital readiness is a priority under our recently announced Acute Care Action Plan. Investing in healthcare infrastructure is vital for the future of our health system and our communities. This is how we empower dedicated pediatric physicians, nurses, and specialists to continue providing the high-quality care the families have come to rely on. Thank you to the Stollery Children's Hospital Foundation for your dedication in advancing children's health in Edmonton and Northern Alberta. Thank you to the University of Alberta and everyone else involved in this project. Our youngest patients deserve the very best, and together we're building a future for the next generation of Albertans. And I'd like to welcome Dr. Todd Alexander, Chair of the Department of Pediatrics from the University of Alberta, to provide remarks.
Thank you, Minister. This announcement is welcome news, news I've been hoping for since I was recruited almost 20 years ago. Although I never thought I'd be at a microphone as part of such an announcement. This is exciting news for Alberta's families, for the provincial healthcare system, and for all the students, child health innovators, and healthcare leaders at the University of Alberta. A new standalone pediatric hospital will quite literally support the future of our province. It will provide our healthcare faculty, staff, students, researchers with the space and tools they need to provide the best care possible to our young patients. It will also help us to continue to attract the world's best child health clinicians, educators, and researchers, all to provide cutting-edge health care. In this new hospital, the University of Alberta will be honored to continue its important partnership with Alberta Health Services, the Stollery Children's Hospital, the Stollery Children's Hospital Foundation, in order to train pediatric healthcare providers, accelerate health science discovery, and connect those discoveries to practice and improve the outcome of our patients. Over decades, University of Alberta faculty members, many of whom are actually practicing child health clinicians at the Stollery, have led creations of life-saving treatments and improved practice of care. I'm sure there are some of us here today whose families have benefited from this work and have found comfort in the expert care at the Stollery. Together, we have achieved incredible leaps in understanding and treating pediatric diseases, improving standards of care, and identifying early interventions to reduce the risk of chronic disease, including obesity, cardiovascular disease, and diabetes. I am grateful to the Government of Alberta and the Stollery Children's Hospital Foundation for this investment in children's health, which will provide an environment that harnesses the intellectual curiosity and passion of so many child health scientists from across the College of Health Scientists at the University of Alberta. We look forward to welcoming this transformative children's hospital to Edmonton and continuing our collaborative efforts to enhance care for Alberta's families. Thank you. I turn it over to Karen.
Hi, everyone. Today is a good day. I want to thank the Government of Alberta, the University of Alberta, and everyone who made today possible. I'd like to first acknowledge representatives from the Stollery family, Doug Stollery and Jeff Bryson, who with us remember the legacy of Bob and Shirley Stollery. This is a historic moment for kids' health and for every family who's walked through the doors of the Stollery. Today's announcement, securing land to build the new standalone Stollery Children's Hospital, brings us one step closer to a very long-held vision. Imagine a place built from the ground up just for kids, where care is easier to access, where spaces reduce anxiety and heal hearts, and where the best minds in medicine, research, and innovation come together for our children. Everyday families come to the Stollery facing some of the hardest moments of their lives. And they tell us what it means to have both top medical care and a family experience of compassion and dignity. This new hospital will give those families more than just hope. It will give them the very best chance for brighter tomorrows. We're in the renovated beach, an example of what kids deserve through their entire medical journey at the Stollery, and an example of the power of community support. And that's why we're proud to launch No Bounds, a bold, once-in-a-generation comprehensive campaign to redefine what's possible in pediatric care across Alberta, Western Canada, and beyond. The campaign will not only support the new hospital project, but establish the Stollery as a global destination for excellence. It'll attract the brightest minds, advance leading-edge treatments, and offering boundless hope for kids and families. It's time to dream big for our kids, and we're going to do that. We want to work with our community to raise $1 billion. That's right, $1 billion to transform children's health. The phrase No Bounds reflects the belief that there are no limits to the potential of Stollery or the children that we serve. Our campaign is rooted in a playful, space-themed concept and celebrates the curiosity, the courage, and dreams of children who reach for the stars, and we should reach for the stars too. It challenges us to ask, why can't Alberta be the healthiest place to raise a child? Because we believe in kids first, always. Our role at the Foundation is to inspire generosity, build partnerships, and bring communities together around this vision. We'll work as one team with government, the university, our hospital partners, and the community to make sure this transformative campaign changes kids' healthcare for generations to come. We already have an amazing Stollery team, and now it's time to have the space to match that talent. On behalf of the Foundation, including our board chair, Kevin McKee, who is here today, and our campaign chair, Richard Kirby, thank you so much to the Government of Alberta and the University of Alberta for your leadership. We're going to build a world-leading children's hospital because every child deserves the best chance to live a long and healthy life, and there are no bounds to what we can accomplish when we work together. To the families and children who inspire us every day and those who we will come to know, this is for you. To the family, and now I'd like to pass the podium to one of those families. It is my absolute pleasure to introduce Jody Richardson, mom to Emmy. She's our little astronaut, and they're both here today. Come on up.
Hi. The Stollery Hospital means the world to my family. It is the reason Emmy is standing here today. And our story, unfortunately, is not unique. The Stollery has changed the lives for countless families in Alberta. It has provided us a safe space for truly the scariest times in our lives. The staff here have not only managed to provide exemplary care for Emmy, but have also made her laugh, smile, feel safe, and the biggest gift is given her space to play and just be a kid in hard, awful times. They have managed this incredible level of care in a space that unfortunately is not conducive to the needs of those in it, where the needs have outgrown the number of beds, and where shared spaces make it even harder for our kids to just be kids. This is why having a standalone and purposeful built Stollery Hospital means so much to us. Instead of shared rooms with sometimes up to 4 families, it can be space for families to have their own room. Speaking from our experience, it is very challenging to share a room divided only by a curtain when you're more scared than you ever thought you could possibly be, and your child is in pain, uncomfortable, terrified, all while hearing others experiencing the worst days of their lives as well. A standalone hospital also means space that is just for children and families. The Stollery is a safe space for children and families, but walking outside the Stollery halls mean that children who are already facing very big, very adult situations are now faced with large, actual adult situations. It is one more piece of their innocence that we can't protect in a shared space. The new building will give them the to be children, to run, walk, wheel down the halls, and not worry about adults in their own crisis. As I've said, the Stollery has changed Emmy's life, the life of our family, and the lives of so many children and families, a number that will continue to grow every day. The staff here have managed to provide world-renowned levels of care and have done so with limited space, shared resources, and so many more challenges from a shared hospital. It is going to be truly incredible to see the work that they will do with a child-centered, purposeful, and thoughtful space. We get to see the best of the best working in the best of the best. This new hospital means everything to our family and so many more families, and we could truly not be more grateful for this opportunity. Thank you.
Hello. Okay, we're going to take questions now from the media on the site selected for the new Stollery Hospital site. We'll do one question and one follow-up. The mic is just behind the cameras there. When you do ask your question, please start with your name and the outlet that you represent.
Hi, thank you. Sarah Ryan, Global News. I'm just hoping that one of the ministers can talk a little bit about the funding. You mentioned 2027 that you'll be looking at funding, but what is the projected cost and where do you expect that money to come from?
So we don't have a projection currently. We won't be able to figure out what the project will actually cost until we have first and foremost functional programming and planning completed, and from there we would move to design. And at that point, we would have a really good idea of what the funding would cost for the construction, in which case we would go to the Treasury Board and request the funding there.
So are you anticipating, are you anticipating money from the federal government as well, from the municipality, or all the province?
It would be the province, yeah. Thank you.
And then as my follow-up, can you
That was the follow-up, thank you. We'll flip to online for the next question.
Your next question comes from the line of Matthew Black from Edmonton Journal.
Sure, I'm hoping you can tell me a bit more about what made this site the right spot for this project.
Sorry, could you repeat that? It's a bit muffled.
I'm hoping you can tell me more about what made that location that you're announcing today, what made that the right choice for this project?
Yeah, thanks for that question. The fact that it's so close to the North Campus, it will help us to enhance collaboration among clinicians and researchers and medical training programs, and it's a nice, convenient site because of those things primarily, and the fact that it will the parcel will help us to be able to assess long-term needs on a going basis.
Okay, and the follow-up?
Yeah, what might some of the possible plans be for the existing Stollery space when the new facility does open down the road?
That will be left to be determined. I do believe that it will enable us to open up more acute care beds for adult care. We don't have an exact number on that, but perhaps the Minister of Health would like to weigh in.
Thank you, Marty. Thank you. So on the site selection, it's a green space, it's large, room for growth, close proximity to the U of A. These are all advantages when developing this standalone hospital. Right now, we're looking at our top 16 hospital sites to see what activity could be provided outside of the hospital so that we can backfill that with additional acute care capacity. It's difficult to add on to major urban center and regional hospitals, so it does make sense if we can take things and place it adjacent to the hospital or in community, then we can backfill that space with the additional acute care capacity that our system is going to require with population growth, also in older populations that's presenting with additional complexity. So that would be our intention here, is to decant the Stollery to a standalone site and then backfill with acute care capacity. And those plans are currently under evaluation.
Okay, we'll take the
Thanks.
next question from the line here.
Good morning, Amanda with CTV. I'm just wondering if you can give us a little bit more clarity in terms of timelines. It's one thing to tell people at home, families at home, that you've secured this site, now you're entering the planning stages, but do you have any tangible timelines that we can give families in terms of how long that's going to take, when we could see this new hospital open?
Yeah, so fair question. Reliable timelines will have to wait until the functional programming and planning and design work is complete. And of course, there's decisions that are made in those processes that would impact the facility and timelines. But for sure, hospitals are complicated infrastructure to build. For example, just a hospital bed tower, we're evaluating 3 right now, would take 5 to 8 years to build. So that should tell you that a standalone hospital will take at least 5 to 8 years to build. Though the Minister of Infrastructure and I are working with our departments to see if we can expedite the construction of this particular hospital. I am concerned, for example, about NICU capacity across the province. I think we've already seen this year with the up to 2-day delay in children receiving some chemo services due to space constraints here, with sites competing for space, a site within a site competing for space. We do want to expedite this project.
Okay, we'll take the next question from the line.
Yeah, Travis McEwen, CBC News. We've heard, I guess, from a couple different voices on this question, but what do you see right now as the main issue facing the Stollery here and for parents, and how is this new facility going to help with that?
Yeah, I can start, and anyone else is welcome to supplement. But a site within a site is always challenging because both sites have priorities. An adult, of course, pediatric. And so we want to make sure that a modern, world-class facility with state-of-the-art equipment and functionally built children's hospital, we think that'll obviously improve care for children, while also get new capacity because, of course, we can backfill the existing site with acute capacity. So it's a win-win for all patients involved, and both, which will have greater capacity and be more functional. Yeah, go ahead, please.
Sure. Just as a parent who has lived this, shared space is a real challenge. Like I said, we've had experiences where Emmy is in the most acute care wings, and we're with 3 other families who are also in acute care wings, which means you're only being sheltered by a curtain. You don't have that privacy. You don't have that space to feel, grieve, or even just care for your child in the way you'd want to, because you're so focused on someone else, or, trying not to overhear their worst day of their lives. The other challenge is that when you walk out of the Stollery halls, it's an adult care facility. Very adult problems, very situations that our children should be protected from in that very much.
Okay, we'll do the next question from the line here.
Sorry, Donovan, can you change the podium mic?
Let's see if this one works. Better? No. Still
Would
low.
would I be able to get that last question again? It was cutting out quite a bit.
Yep.
Yeah, the two of you, please. Yeah.
Okay, so the question was, what are the challenges of the current site within a site model? Well, of course, you have two different facilities at times competing for space that are not optimized for either patient population. So we definitely need a standalone Stollery so that pediatric care can be delivered in a children's hospital environment. And it is our intention to backfill the current space in this hospital with acute care, because of course we're also seeing pressures due to a rapidly growing population that's getting older and presenting with additional complexities. And there are some additional patient challenges, as you will hear from our speaker, about having a children's hospital within an adult hospital. Thank you.
Sure, yeah. It's off the cuff. I apologize because I'm not going to remember what I said. So as a parent who has shared those spaces before and been in those acute care rooms with up to 3 other families experiencing truly the worst days of their lives, and you don't have that privacy. You don't have that space where you can take a deep breath and just be the parent to your child, because you're tiptoeing around other people's challenges and other people's crying kids who are in pain. And it's so much harder on the worst day of your life to also hear so many other people and children in pain. And then the Stollery, like I said, is so safe. And I have literally handed my child over to these people and not felt that like everything is not going to be okay. But when we walk out of the halls, it's an adult hospital. They're seeing adult things that they need to be protected from, because they're already losing so much of their childhood by being here every day and having to make big decisions and have big things happen to their tiny little bodies. So having to see those adult moments and adults in crisis, it really does need to be something that we protect our kids from. So that standalone space will really give them the ability to still be kids in a space that is not conducive for it right now.
Okay, that will conclude this press conference. Thank you so much to everybody for coming out today.
This is yours.